If you have a session on ChatGPT with CIOs, they're scared out of their mind because
we don't have rules of the road.
Where's the balance?
Hold on. So we just got to be thoughtful. This is not complicated. Like rings of the circus or what's in the safest outer ring? Let me ask you a practical question. You're a doctor. Patient comes into your office, has a bunch of social needs. Everyone's talking about social determinants of health. They've got an MA plan. Do you know if that MA plan offers that doctor or that patient a benefit of meals voucher?
Nope.
How many years are we going to have to wait for there to be some regulation that mandates social needs benefits have to be made available the same way that insurance eligibility verification has to be made available? Are we going to wait for that?
Yeah. It all needs to be. Yeah.
Or it's disclosed. It's in all the filings when they filled their MA plan, they filed for CMS. I'm going to offer this supplemental benefit for social needs. It's in the documents that a human is supposed to read whenever they have the time. Boom. ChatGPT plugin. Hey, help me find out if this person's got benefits that can help them, that will help their lives. Why don't we do that? No PHI. Second question. One layer in. CareJourney spends a lot of its time on provider directories. And more importantly, we're the report card for providers, not so much the phone book. But it's the same issue. I need to find a doctor in my network. Congress, every single year for the last 5 years, has passed some legislation that says, fix these things. They're wrong. The phone numbers are wrong. The address is wrong. The doctor's not in the network. They're not seeing new patients. This is a solvable problem. There's this thing called the internet, Google Maps. So doctors are updating their Google Maps so you can get to the clinic, but they're not bothering to update the back end of insurance plan number 23, whose database is outdated because they've got the billing address and not the clinic. Why are we making the doctor fill it out for the 23rd time? Grab it from the internet. Let's go use the stuff that's already out there. Let's get a more accurate provider directory built not because there's one database to rule them all, but because we can read all the existing openly available databases and render judgment. That's a great use case. Let's go there. And then last but not least, we will start to understand disease progression. We're having this multi-billion-dollar debate. Today's Friday. Watch Monday. CMS will release the final rule on Medicare Advantage risk adjustment, which was the most significant economic decision of 2023 for healthcare. Well, second, the Medicaid unwinding breaks my heart. This other piece, opportunity, also is challenging because it's going to cut $10, $12 billion out of the system. And most of that's going to come on the backs of plans and providers who serve patients in underserved populations. So let's see what happens on Monday. But you're going to start to get at the question of what are the characteristics of a patient who is under current course and speed going to have more disease progression, more visits to the hospital, more visits to the ER, but for a better coordinated care experience. That's the whole point of risk adjustment. This patient is going to become more expensive in the future. We'll pay you more to manage their condition now. Mm-hmm. Claims data is a blunt instrument to figure that out. Incorporating clinical data and unleashing some of the analytic power that we're seeing should get us to the right answer faster. So the answer is not, let's eliminate risk adjustment and go back to like crazy town where disease goes undetected and people, crash into dialysis in the ER with more frequency. Right. Let's double down on risk adjustment to do it right. I wrote a piece with Adam Bowler and Gary Becker about this issue a few months ago. And then we've been diving deep on the CareJourney on the V28 model, got a bunch of content on our blog. So I think ChatGPT needs to be introduced thoughtfully with guardrails. Mm-hmm. It's not going to come from the regulators. We're going to have to do that as an industry to come up with codes of conduct. And we've done it before with the Karen Alliance and consumer designated apps. I'm ready to roll up my sleeves. Let's go again on applications that maybe the ChatGPT plugins or something that give us a framework for how to govern these amazing tools.